Tonight, we learned that Walgreens should be getting the free N95 masks in stock by the weekend. The federal government is allotting 3 free masks per person. Meanwhile, here are the latest COVID numbers. The positivity rate is right at 43%. There have been more than 45,000 cases in the last 7 days. That's a big drop from last week. However, the number of those hospitalized is closing in on 3,000. We haven't seen that number this high since last January. 4,083 of those are in the Huntsville hospital system. That's nearly 5 times the number hospitalized a month ago. Our Nixon Norman has more on the currently dominant variant, the Omicron variant.
The Omicron variant has been shown to be extremely contagious, but health experts say this surge could be leveling out.
The big track marker that I look at that keeps me optimistic is case positivity. We're really starting to see a plateauing. We were climbing through 40, 42, 43%, and we're really starting to see that hold off rather than continue to grow.
The Omicron variant has taken over and done so quickly. And although Omicron cases are said to be less severe than Delta cases, people are still out of work and school because of this variant. What's changed, though, are those CDC guidelines.
One of the reasons it was so high during Delta was we still had that 10-day quarantine, 10 to 14 day. It depended on vaccination status. But with Omicron, CDC has reduced the quarantine and isolation guidelines. So it's still roughly 20%, and we're at the peak right now. It's about 20% right now that we'd expect to be out of work, out of the classroom, wherever that might be.
Judd expresses that this Omicron surge has probably hit its peak, which is a good thing, but she also mentions that this will not be the last variant that we have to deal with.
We know that it's going to continue to mutate. I think that's the big takeaway. We can follow what's happening in the world. We can watch a surge in another country and be prepared for when that surge comes here.
And although it's unfortunate that health experts foresee other surges and variants, we can learn from these patterns so that we can better deal with those things in the future.
We had great data from South Africa this time to know that the hospitalization rate was probably going to be slightly lower with Omicron, but that it was going to spread much more rapidly. It gave us the chance as a public health community to get ahead of some of the messaging.
Nixon Norman, Fox 54 News.